Theory of mind is something that's very important when we talk about interventions with children with autism spectrum disorders. Theory of mind, the easiest way to explain it is that it's our ability to think about thinking. And that is, it's our ability to infer that other people have different thoughts than we do. Other people have different experiences than we do. And everybody kind of has their own way of viewing the world. Most people who do not have an autism spectrum disorder understand this intuitively. So very young children, for instance, will know if they have something that's interesting and they're looking at it, they know to turn it around when they go to show it to you, because you have a different perspective. They just know, wait a minute, you're seeing the back, I want you to see the front, and they turn the object around. And that's kind of a very beginning understanding of theory of mind. We see things differently. It becomes much more complex with understanding, for instance, that people can go to the same movie, but some people will like it and some people won't. Some people are going to laugh at some places and other people won't think it's funny. That everybody has a different perspective and idea. That people have some knowledge. You can't walk up to just anybody on the street and just start to talk about archaeology, because they may have no understanding of archaeology whatsoever. They might not understand what you're talking about. That there's these prerequisites, that you have to do, such as saying, oh, are you interested in archaeology? Or, have you ever thought about dinosaur bones before? And if somebody says, never thought about it, you kind of know that's not really a place you want to go with that person and talk with that person. So we have to understand, in order to be successful in life, that other people have different thoughts, different ideas, and we need to understand that people think differently. People have different knowledge, and what happens oftentimes with very high functioning children with autism is they forget that you don't know what they know, and so they'll sometimes just start talking to you about things that you don't know. Or I've experienced where, like, a child will say to me, what was your favorite part in Harry Potter? And I'll say, I didn't see it, and they'll say, I know, but didn't you like? And it's like that information of, well, I didn't see the movie, so I don't have any knowledge about it. That's difficult for them to understand because they know about it. It's difficult for them to kind of read my mind sometimes and understand that we can't really talk about this movie because I didn't see it. And this is, again, so important when it comes to developing appropriate social skills and developing high-level social skills, friendship skills, knowing how to navigate the playground and the social world, being able to understand, everybody isn't only going to want to play by my rules, that sometimes it's beneficial to do what other people want because then they're going to like me better, and then sometimes they'll let me do what I want, and kind of understanding that give and take. That back and forth of social interaction is all based on theory of mind and understanding how other people think and feel. And so now one of the thoughts is that this difficulty in developing theory of mind is another core feature of having an autism spectrum disorder, and that if we really want to help children develop better social skills, and in a way then develop better behavioral skills, because the more you understand your environment, the better you're going to act or react within that environment. And conversational skills, which are language skills, they all stem from understanding theory of mind. And so addressing theory of mind is sort of a pivotal area that you want to address to help children, again, be able to maximize their potential in all areas.